Yes, ma'am, you are.
Okay.
And I'll moderators will start the session. So over to you, Aksha.
Okay. Hello and good morning to one all present here. I am Akshay with my co-host Shreya, and we are your moderators for this session. So today we have brought to you a webinar with the topic "Restore Youth to Your Smile." That is a webinar on facial aesthetics. Now let me introduce to you our speaker, Dr. Megha Nagpal. She has completed her BDS from ITS Dental College, Muradnagar. She has also completed her MDS from the same college in the Department of Conservative Medicine. She was also a university topper and a gold medalist, and the best postgraduate student as well. She was also the best undergraduate 2013 by Bioforshad Academy held at Army Dental College, New Delhi. Currently, ma'am is a smile designer and a medical aesthetician, extremely passionate and ambitious about enhancing aesthetics and redesigning smile. She is also founder of Aesthetic Clinic, New Delhi. It's a pleasure to have you with us, ma'am. And a note to the audience, kindly write down your questions in the chat box.
Okay. Hello, everyone. I'm Dr. Megha, and she's given quite a detailed, introduction to me. I don't want to make it too monotonous by, creating a PowerPoint presentation, giving you lectures or certain definitions to memorize. This is basically but I genuinely want you all to know what facial aesthetics is. Basically, facial aesthetic is aesthetics, as it is a very normal English term synonym to anything called beauty, right? So, aesthetics, facial aesthetic is a branch of dentofacial aesthetics in order to the features of our facial appearance. That involves our lips, that involves our nose, our chin, our jaw, our cheeks, and our teeth. So, well, know that the smile or the teeth plays the major vital role when it comes to facial appearance. But we should not forget that even the other parts, they are in harmony with our smile. So there are a lot of people who are incompetent or feel a little underconfident because of the lips. So while we create smile with a veneer or any cosmetic dentistry, we do consider the fact that the lips can be voluminous, the lip can be lifted. So we have a lot of things that involves facial aesthetics, involving or starting with smile designing, cosmetic dentistry, cosmetic treatments for the face, mesotherapy, anti-wrinkle therapy, anti-aging therapy, accentuating therapy, and we entail a lot of things like Botox, fillers, thread, etc., etc. So when it comes to facial aesthetics, the number one question we dentists have a question about is, are only the dermatologists who can practice it? Are we actually licensed to practice it, or are we authorized to do it? Is it something illegal? Yeah, that's the main question that arises. So that while I was doing my masters, I did happen to visit states for some purpose, and there I realized that aesthetics is actually the community that holds aesthetics together are dental people, and we were so less aware about it. When I say facial aesthetic, I would rather term it as dentofacial aesthetics because everything revolves around the smile. When you change the lips, your nose starts upper. When you change the chin, your lips start looking more prominent. When you change the smile, your lips start looking more lifted. So it all goes about in a harmonious action of all being a unity acting together. So facial aesthetics can be pursued by medical background people, nurse practitioners, physicians. Those physicians can be dermat, can be anesthesiologists. I meant physicians and dentists. In fact, the panel of facial aesthetics were actually of dentists. And in India, we lack the information about the licensing, about the exams, etc., etc. Comes to aesthetics, I mean, trust me, I'm asking all of you this question. Aren't we all so competent to give injections inside the mouth? When you meet XYZ doctor, it is something really fancy for them to give a local anesthesia in the gums. But when you ask us, it's pretty easy. It's something which we do in our daily life. So injections are basically the injectables is that technique that is incorporated into the world of aesthetic. Now, when I, as a practitioner, unite cosmetology and aesthetics, they become a nice, med spa kind of oriented segment. A world that has med spas in such a rise and shine position, where we incorporate all the treatments together, be it be the dental, be the aesthetic, or the cosmetic definitions. We never, intermingle or go against any doctor. We practice very exactly what is our issues, and that involves the whole face. Even the definition of dentistry involves including the structure, soft tissue with teeth, that involves the soft tissue we've been working on. The oral surgeon, the oral maxillofacial PGs have been doing PRPs. It's that with nanosecond we see a lot of development, we see a lot of awareness about such a variety of things we all can explore competent level without feeling insecure, without feeling incompetent, without feeling that no, we cannot do it. We all have it in us. It's the practice, it's the guidance, it's the right path, it's the right knowledge and brushing of experience that matters. So I even thought I'll show you all parts of aesthetic. Like I've been speaking about fillers. You all want to see what fillers are? I can show you some of my products.
Yes, ma'am.
So there are a lot of varieties of fillers. There are hyaluronic acid fillers, there are hydroxylapatite fillers, polylact, a variety of. I can see a lot of questions. Ma'am, dental students do cosmetic. Yes, dear, that's what I've been talking about. We can do cosmetic treatments. I will come upon by step. Like the medical qualification, yes, you all are overqualified to be a doctor. BDs can also do it, and MDs can also do it. I will differentiate what is the difference, how are people going to treat you differently, in order to be very clear. So you can keep asking Juvederm. Then this is Restylane. Actually, I'm one of those who really practice both of these. I'm going to show you. It's a brand new one. So this is how a filler looks like. Okay, it's absolutely gel-like consistency. Needles along with it. Okay, very thin gauge needle. I preferably use cannula. A cannula is something similar to a needle branch, but is blunt. So what I do, I make a hole with the needle, but then I use cannula to do my, going here and there in directions. So this is a filler. That's Botox. These are the units of Botox for my patient. Costly. So I have this box where I keep my fillers that are left. I always say this. I always say this. Sign it. So I always do my fillers in 2 sittings. So when you have a filler, what you do, you basically assign the cost according to the syringe used or according to the ml used. So while I'm doing the first sitting, I save this much. So I can do a little of the fixing. I request if people could.
So sorry, ma'am, for the disturbance.
It's
Apurva, can you please mute? Apurva, can you please mute yourself? Thank you.
I did that.
So this is a filler, okay? So this is, I'm going to open it. I'm not going to show you, but it's like a very gel-like hyaluronic acid. So yes, that's about the fillers. Now I'm going to talk about the fillers in per se. Now, as the name suggests, fillers, that fill, right? Something that gives a volume, something that is also used to remove the creases, to remove the wrinkles, to give a lifting effect. Fillers are basically, in layman terms, a fountain of youth, a modern fountain of youth. Everyday life happens. You have to age. So they come in a category of anti-aging doctors. There are a lot of therapies, not just fillers or Botox. There are innumerable therapies like mesotherapies, like stamping therapy. Many. When you enter the world of aesthetics, you cannot stop learn to learn. Like the way we did in BDS, we used to have lectures. We even did anatomy, we even did physiology, we even did pathology. Every basics has day to day. Because while a patient comes, you need to have their blood pressure, you need to have their medical history. everything harmonizes. We've been learned, we've been educated well to practice and exercise it. Now, when it comes to what colleges to pursue, what have I done? See, say just being a BDS or just being an MDS is not enough. You need to do courses. Now, when it comes to courses, things like facial I'm just focusing on aesthetics. I will come to cosmetics also because it is a part of it, but it has a variant of courses. Okay, so facial aesthetics, you can do masters. Now, this is not something like going to a regular school. You can even do diploma courses because you have a university. So anyone who is a facial injector has to have a medical degree, a university degree of medicine. So we all have that. All we need to do is or get a fellowship or get a master's for our experience. The more competent you become, the more confident you become, the more good you will be in action. Now, when it comes to how to choose, do we have to give an exam? Do we have to pass a license? No, we don't. We absolutely don't have to do that. There are certain societies that expect to show you, like, because I've been trained by few very good leaders and very good dentists who would collect a lot of cases. And then there were few colleges I wanted to apply. So they have levels like level 1, level 2. Level 1 is the basic foundation. Then after level starts the advanced foundation. So what they expect is that if you have done earlier courses, we would like to see your cases so that you can join this level. If a person like you, Amra, or anyone, Apurva, you want to start with facial aesthetic, you have to start with the basic foundation. So for basic, there are a lot of doctors, there are a lot of dentists in India who are pursuing it, also abroad. So if I talk about my journey, I've been blessed by very good doctors. Visited I had a plan of facial aesthetics in my head. I will not lie that it happened overnight. I was actually planning to go to Germany, exams through it, and there, like aesthetic dentistry and aesthetics, knowing very little about. During that journey, I National Academy of Aesthetics in Beverly Hills, California, and there I just took a course for Botox. Understood that Botox is a neurotoxin. Botox decrease the face, and I was so fancied and so attracted to this field, and it gave me such a good boost that, man, it's done by dentists, all of them. Even the founder there is a dentist. So I realized pretty below, or I myself I'm not too, so there was hardly anyone who could guide me through the journey. And then I happened to meet Dr. Rajat Bhandari. He conducts courses 3 days, 5 days, very good courses. Meet Dr. Shaurya, then I went to Jamnapai. I would not stay. I stopped somewhere because I knew that I have to exercise my skills. I took good fillers and practiced it on my family after doing 2 to 3 courses. You just cannot do 2 fillers and plan to open a clinic. Or I shouldn't generalize and do that too if you're too confident. But I always believe that until you create your own technique of aesthetic delivery, you wouldn't feel that confidence. It's not something to be learned. It's not something to memorize. It's actually an artwork. And we all dentists, we've done POP work, we've played with plaster of Paris, then dirtied ourselves with alginate. So we know how it all works, right? This is as simple as that. We all are thorough with the facial muscles. We are thorough with the facial nerves. A theory. And we as dentists can brush it up very easily. So it's not a rocket science at all. But the big but, you need to read about it. Do not think seeing YouTube videos or Instagram profiles like mine, you can learn it. Oh, it's a cakewalk. I can do it. Yes, it works when you practice it. Yes, it is a cakewalk when you're doing it every day. But every day you encounter a new complication. Every day you encounter something new. I have actually gone to a lot of doctors, and they all have been great. They all have their very unique techniques because they've been experienced through a very, very, very long. Now, when I did my aesthetics, like, I did a 5-day course. I think I did an 11-day course in States. I did in Sweden. Then I went back to Jamnapai because I was so intrigued that I just don't want to stick to aesthetics. I want to learn what cosmetology is all about. So they have a complete program. They have a diploma. They have fellowships. And then there is another MATA, that is Association of Aesthetic Training. That's basically in London, Harley Street, but they even have it in Mumbai. So you will be certified from there. So it's not that we don't have sources. We have a lot. They all are so well equipped, so passionate to teach. I think that's how one should be so intrigued about it. Any questions I would like to, answer now? I've given a brush up of aesthetics. Now I can at least answer a few of your questions and I can go to certain points.
Moderators will help in this. They will
Ma'am,
ask you
I
questions.
have a question.
Hi Shreya.
Hi, ma'am. How are
We
you?
haven't talked. We just texted. I have not
Yes,
talked to
ma'am.
Shreya in person. How are you? You were very
Hi,
interested
ma'am. I'm
in
fine.
aesthetics, I remember.
Yes, ma'am.
Yes.
Ma'am, there are a few questions I would like to ask.
Please do.
Ma'am, what is the scope of facial aesthetics after BDS?
I'll be very frank with you all. There is only one negative point. I think that sometimes people don't take you seriously. Sometimes. But again, if you do diplomas, if you do fellowships, or you do even the courses that are certified, you know you have the knowledge, right? So yes, a BDS can equally do as an MDS. It's just that in MDS or during any 1 year internship or a BD, I got more equipped with my handwork. If you think your internship wasn't enough for you to learn it, then I believe, you should, if you're absolutely not interested in masters, please put your time and energy into the specific courses you're interested in. Like if you're opening a dental center, I'm more interested in the conservative. Please do a conservative course. Please do aesthetic course. Unite yourself. Be a little more experienced in order to have. Because at the end of the day, if you're my patient sitting on the other side, ask me certification. Specifically, people in Delhi. Let's be specific. Yes, they do. They come see the whole procedure through YouTube and ask you questions more than justify them in a consultation. So for that
Okay.
reason, I believe education is never a waste. I've never felt a waste. I've been traveling a lot for my course. Just doing mere internship. I've been an observer in Stockholm for just 3 days with a nurse. And I think I've had my best experience in aesthetics because it was more like in India, everybody comes for an eyebrows. 8 o'clock, they used to come for the Botox, they used to come for cheek. It was such a beautiful experience. Even if you don't do, because I had experience of doing it myself, seeing was more easy. So never start with the opposite. What I see in India, people always start with interning and observing, then they go and practice. No, I exercise is completely opposite. I believe in learning, in exercising, and then either parallelly I would intern or after that, because then I will know how to exercise it in a clinic, right? So yes, BDS can do it, but I believe again that what competency and what handwork means. So for that, if it's masters, it is just a diploma, a fellowship, or certain other courses you can collaborate in order to have your handwork better. And it gives even an edge while you're talking to a patient and you don't feel underconfident.
Ma'am, also any particular branch that help more with aesthetics?
No, I wouldn't say that. I am an endodontist, so I used to give a lot of injections, and I give pretty injections today also. So yes, I wouldn't generalize. Oral maxillofacial surgeons are too good with injections themselves, but it's not that. I somehow believe knowledge is something that should be, more good to entail with. Not really specified. Even oral pathologists are doing who themselves are. It's all about the passion and the knowledge and the never-ending urge to learn. Don't start believing, oh, how much will I? Please invest your time. It's not always about money. It is about money at the end. I shouldn't lie that. A clinic should work hard, but if you think you have invested that much time and energy towards it.
Yes, ma'am. Thank you. And ma'am's next question is which is due to pursue aesthetics, facial aesthetics?
I wouldn't call it a best institute. In India, our doctors are so good to teach. Jamna Payar, Dr. Shaurya, Dr. Sushi, a lot of doctors who are really, really, really good in teaching. And so are many abroad colleges. MATA is there, I there, American Academy of Aesthetics is there. Then there's International Academy of Aesthetics in Russia. There is BAI there is another in Philadelphia. There is where I went is the Sixth Street Dental Aesthetics. That's in Pittsburgh, where I did my internship and learned lots. So there are many. You just open Google and type aesthetics. If you think it's always to do baby step, please start from the doctors who are entailing around you. Don't ask if I can be an intern with you. Ask how many courses they do. So just start learning. Don't just believe or stick to one. That's very subjective. Please do not think it's a line. I believe it's always good to learn and explore.
Okay, ma'am. Ma'am, next question is how was to learn Botox from Sweden?
It was not just Botox. I think I shouldn't answer that. Please ask Dr. Rajat. He will know how much will he charge. But see, things cost. I wouldn't lie. So it ranges from 2 lakh. It ranges from 5 lakh. It depends where is Indian cheaper than compared to the international courses. But then your experience also varies. So yeah, but they are worth. I wouldn't lie. All of them are worth. One from Sweden and one from Stockholm.
Ma'am, any degree course in India for facial aesthetics?
Yes, there are. There's a few in Mumbai. Jamnapai gives legit course. I think it's 3 months course, 6 months course, a routine course that involves cosmetology as well. I'm not sure about. I've heard people talking about it, but I'm really not sure how it is. But yes, they also give degrees in Mumbai. So please type Mumbai. Please write it down. I'm not name. And the MATA also has a center in Mumbai related. The MATA is medical aesthetic training. That's from London. Even those have in Mumbai. So Mumbai, yes, a lot of dentists have been practicing it since years. So it's nothing. I've met a lot of my patients who are from the industry. So I realized that I am one of those, but a lot of dentists have been doing it.
Okay, ma'am. How did you apply to Tufts University?
Tufts University journey started from the college itself. I was chosen to as an exchange student from our college, but I made good contact with Neeraj, and then I visited them again to learn a little more about aesthetics. It was more like an internship and observership, but we did not do the patients because that's not where we did the preclinical work and learn a lot. So it was through the college. You can also apply if you want to apply to Tufts University. The biggest myth you have to clear that NBD. No, it's a specific exam for Tufts University. It's not the routine exam that goes for states. So in states, apply to college for dentistry. Do not think everywhere you have to give that NBD exam. You have to give an exam. It varies states to state. So both that Tufts University or XYZ, a lot of colleges, every state has a different rule. So you have to go through the state rules in states.
Okay, ma'am. Ma'am, next is what are the side effects of using fillers and what if they go wrong?
There are a lot of side effects if something goes wrong. Side effect of a root canal also if it goes wrong. So you gave the answer to yourself, Shreya. If something goes wrong, it has a side effect, but if given at the right point, competency level, at a right amount, at a right age, at a right requirement, nothing goes wrong. It is made of a component. If I'm talking about specifically lip fillers, okay, I'm talking about a filler called hyaluronic acid. It's something like a sugar molecule. So we insert plums, it voluminizes. But you do not have to give too much, you do not have to give too less. You know from where to start. So that's what I'm talking. It's not a YouTube. You have to learn, you have to feel what the injection feels like. And I wouldn't lie, I've practiced everything on myself. So when my patient comes, I have pain they go through. I know what apprehensions they have because I myself have been through it. So that's the true thing. We very frivolously use the term, I'm about this. I am very, extremely excited to do this, but we really don't know what it means. I have done every bit of what I do on my patient, on my, some by other doctors, some by myself. So I think that's passion. I sleep by reading some new article from PubMed. That's a recent development about a dermal film or the world of aesthetics. And in the morning, I read about, revise about it in my head. So that's called passion. So if you have it, please don't have it. It's not too late. Just
Yes, ma'am. Ma'am, next is what is the difference between the treatment done by a cosmetic surgery and a dental student who does facial aesthetics?
Uh, if you're talking about particularly plastic surgeons or dermatologists entail the area also of skin diseases. They're the real doctors of skin. What I'm talking about is something that is anti-aging, something that accentuate your features, something that doesn't involve prescribing you medicines that are related to skin or a specific part of the body that you are not entailed to do. But if you're very competent enough and you've learned good, you have more artistic sense of aesthetic. Believe I know where a contour lie or where there's a highlight one, where I want to look. I mean, your eye of delivery of how your patient should look, that matters, not the age, not the degree. It's the competency, the passion, the right knowledge, and being aware about the complications. So it's not wrong to say it's pretty the same level when it comes to facial aesthetics. But yes, what is their honor is theirs. Like if you ask me, एक रूट कनाल एक डेंटिस्ट है या MD skin doctor, that's completely different. So if you're talking about aesthetics, that is a mutual topic to both of us.